Ultrasound can be a very useful complementary modality for massage therapists. Ultrasound uses sound waves to affect different tissues in the body, such as tendons, ligaments, and fascia. They run at different frequencies and intensities, but they all stimulate the tissue. Gel is used to reduce friction on the client's skin, and the intensity will decrease the deeper the sound waves get.
The patient has come to you explaining that they've been experiencing ankle pain. Objectively, you establish that their ankle just has not felt right following an ankle sprain that occurred 3 months ago. And you also establish that this has occurred in the past, just simply not this badly. Pain questions are important in this instance, as they can establish that the injury is not just similar to that of the occurrences in the past. By asking pain questions, like point directly at and scale the pain between 0 and 10, your assessment will make sense according to the process of establishing clinical impressions. Your assessment will also be done in a safe and comfortable layout whereby the patient can experience the least amount of discomfort. Asking the patient about medications they are on is important to know about, as they can offer a wide range of yellow and red flags and various contraindications the interview may not reveal. It is most of all important to know if they are on any pain medications, as this will alter their sensation and interpretation of pain during either treatment and or the assessment process. Even in the chronic stage, watching a person's gait or a patient's gait can provide a wide variety of information. When a weight-bearing joint is impaired, there are various other aspects of the body that become impaired secondary to the primary concern. Posture is also important, as it establishes many of the same ideas as gait observation will, in that there are other aspects of the body that become impaired. But most importantly, it is important to observe a patient's posture as you gather an understanding of how all of the weight-bearing joints from the head to toe are working together. Range of motion testing may reveal much the same information in both acute and chronic stages of healing, except in the chronic stage you would expect to have much less severe pain, or specific aspects may be completely absent altogether for pain, or other descriptions may just be vague and hard to describe for the patient. Listing what the range of motion testing would look like in active range of motion, or for an acute stage, may look like active range of motion. Dorsiflexion would be discomfort. Plantar flexion would cause pain at end range, most specifically. Inversion would be generally empty, or patient basically would be unwilling to really get a clear understanding. provide a clear understanding. Eversion would be discomforting. If you were going into passive range of motion, dorsiflexion would be no pain and within normal limits. Plantar flexion would be discomforting. Inversion, also discomforting. Eversion, discomforting. And if you were to test the resisted range of motion, dorsiflexion would be painful and weak at a stage of 3 out of 5. Plantar flexion would also be painful, 4 out of 5, more expectedly. Eversion would be painful and weak, and about 3 out of 5. And eversion, you may expect to see a pain of 4 out of 5, strength of 4 out of 5. You would rule out the ankle, or the toes and the knee, and in this specific setting there was no negative or no positive testing and indications of peripheral joint involvement or outer joint involvement from the injury. Even in the chronic stages of healing, it is important to develop a clinical impression of the patient's current instabilities and complaints. Although much like range of motion testing, the chronic stage of healing may present with skewed responses in a series of false negatives and or false positives, but the information gathered through orthopedic testing remains significant in a safe and clinically professional setting. Furthermore, you may also reveal specific aspects of the injury that the client was otherwise unaware of. Positive and negative indications of these tests resemble that of a patient in an acute stage of healing. Negatives and positives may or may not reflect that of a patient in chronic stage. If you were to perform an anterior drawer test, the test would expectedly be negative. On a posterior drawer test, the test would also expectedly be negative. In a varus test, you would expect a positive test, and a valgus test would hopefully present with a negative test. And a talar tilt test would also be positive.
Ultrasound relates to our current experience in school and could benefit us in many ways going forward as RMTs. Currently in sports outreach, we are learning about massage in an athletic setting with a variety of different athletes from different sports or competition. Ultrasound could benefit most, if not all, athletes as it speeds up the healing process. Athletes who play contact sports on a regular basis, especially at a high level, need to recover quickly and could have competition or a game as soon as the next day. Although using ultrasound with athletes would be primarily a post-game treatment, it would still assist in getting them ready for the next game to come. In labs and clinics, we always focus on biomechanics and preserving our bodies, specifically our. An ultrasound machine would assist us in this, as we could warm up the tissue using the ultrasound machine instead of our hands. Ultrasound machines will also stimulate deeper ligaments and tendons that are hard for us to get at without applying significant pressure, and doing that would be painful or uncomfortable for the client as well. There are different certifications involved in becoming an ultrasound technician. In training, you can get a certificate, an associate's degree, or a bachelor's degree. The certificate would be enough to qualify an RMT under the CMTO standards to use an ultrasound as a complementary modality. You can buy various ultrasound machines for a wide range of prices starting around $500.